On Tuesday, President Trump announced that he would withhold contributions to the World Health Organization and blamed the agency for not alerting his administration to the dangers of the coronavirus. For reaction, I'm joined by Andrew Slavitt, former acting administrator of the Centers for Medicare and Medicaid during the Obama administration. He joins us from Minnesota. All right, what's your reaction, Andy, to Trump and the WHO?
Well, thanks for having me on. This is not an opportune time to start to defund any efforts at public health. I think that should be hopefully obvious to most people. Donald Trump is no fan of global institutions. I think he certainly wants to take steps to make sure that blame is placed in places other than where he is. I'm not suggesting that the WHO did its job perfectly here. I think whether it's the WHO, the CDC, or anybody else, plenty of blame to go around. But in the middle of a crisis, to take the feet off the street that you need in the middle of a global epidemic doesn't make a lot of sense to me.
Would the Obama administration, as you knew it, have been prepared for this?
Well, look, it's hard. It's hard to prove a negative. I think I'd say two things. One is there was uh, a a structure in place that would have been able to respond more quickly. I think that's the first thing. The second thing is that they wouldn't have probably no other administration, whether it's Obama or else. I think it would have been highly unlikely that they would have spent January and February ignoring warnings. And the problem is that when if you're 2 months late at getting on something, we've all been late before. You can usually recover, but when you're 2 months late at something that's growing exponentially, it's kind of like a speedboat swimming after a speedboat that's 15 feet ahead of you. By the time you get 15 feet, it's 100 feet ahead of you. So that was very costly time. So I don't think this is an easy crisis to handle. I wouldn't claim for a second that anybody would handle it perfectly, but it would have been an enormous difference if we would have been able to get out ahead of it a couple months earlier.
Do you regard Trump as a wartime president?
Well, let's think about what our best wartime presidents do. They arm their troops, they read the data, they're skeptical of good news, they are decisive, they move their troops around, and they make quick decisions. And they follow the data. They're not instinctual. So I would love for President Trump to take on those characteristics. Those aren't his, I think, tendencies. I think he's more instinctual. I think he's more liked to be praised and sees himself in the problem. I don't think he has made it a priority to arm the front line, namely the doctors and nurses, but he should. And I would give him all the credit in the world if he did.
Let's talk about nursing homes. The best data, and it's very incomplete, says that at least 2,500 nursing homes in 36 states have coronavirus infections, but the federal government is not tracking the incidence of COVID-19 infection or deaths in nursing homes. Why not?
Well, look, we have 1.5 million people living in nursing homes today, and millions more living in senior centers and other places like that. Um, these are people who are of a generation that built this country, lived through the Depression, many of them, and they are now they are owed to their last day a dignified, healthy life. And in 2017, Donald Trump eliminated and said he would no longer enforce the nursing home regulations that were put in place to reduce infection levels in nursing homes. And I said, I don't think he'll ever say he regrets that, but that was a really bad decision. Many of these nursing homes in the country, once an infection spreads, given the way they're designed, once one person gets something, it spreads rather quickly. Many people who work in nursing homes go from nursing home to nursing home. And as the public now knows, much of the time the virus is asymptomatic. And so just no one knows when they're spreading it. People are sick, they're staying home. But if they're asymptomatic, they're going out, they're going to work, and they're traveling. So we're going to see, unfortunately, we're going to see a significant part of the death toll here from coronavirus happening inside places like nursing homes.
Do you talk to anyone in the Trump administration?
Sure, practically every day.
You do. And
I
what are
do.
they saying inside to you?
Well, I think they're at the moment I think they've spent the last month or two trying to catch up with the crisis in ventilators and hospitals and in PPE, and I think those are still issues. I think they're now focused on trying to grow the number of tests we have available in the country, and that's a battle that they're still chasing. Increasingly, I think they are being pulled into a debate around when does the country, quote unquote, open again, which is, I think, a very natural thing for Americans to wonder about and a natural thing for the president to focus on. I think, to your earlier question about a wartime president, if he's looking at it the right way, those are conditions-based decisions. What are the conditions on the ground necessary to open the economy further? Not a decision around picking a date and a date certain. And I think he's facing. I think there will be political pressure given the election in the fall. People wanting to get back to normal, see their sports teams playing. So I think the people right now in the White House are, I think, consumed in that conversation about how do you put together the plan to open the economy, which the president is going to insist on doing, but they're going to have to do it in the safest way possible.
Until we get a vaccine, would you say we're a long way off?
From a vaccine?
Yeah.
Yeah. Well, this is another thing that I hope that the CDC and the administration is more transparent about. You mentioned nursing homes. There's a lot of information that should be shared with the public on a regular basis so we don't have to guess. I think a vaccine, typically it's going to take 18 months working at all speed to get something like this manufactured, safe, effective. It's possible that if the crisis is bad enough, that they'll be able to give some form of the vaccine if they think it's safe enough to frontline healthcare workers who have a lot of exposure, the significant risk that they're at. The greatest thing that we can do is continually socially distant and continue to reduce the spread, because until there's a vaccine, there's really not a great solution. And many people, there's two types of people. Many people have this and never know they have it, but they're spreading it everywhere until the virus finds the people to whom it's lethal to. And I think, until we have a vaccine, we're going to have to be very, very careful.
You were succeeded at the Center for Medicare and Medicaid Services by Seema Verma, and she's a member of Trump's coronavirus task force. Do you talk to her?
I do.
And how is she comfortable? How's she doing?
Well, look, everybody's working incredibly hard. This is a crisis that I'd like to think, doesn't separate us as Republicans and Democrats. The virus spreads equally between Democrat and Republican as it does inter-party. And so it should be a moment that people work together on the best ideas. And I think that's happening in a lot of ways. I'm not going to be Pollyannish and tell you that there's no politics or no differences. There are, of course, but I that people want to save the largest number of lives possible. Then they're working in the right thing in the right direction. I don't envy the task of anybody in the administration right now, and that's why even though I'm of a different political party, I pledge to do everything I can to help them.
You recently launched a podcast called In the Bubble with the help of your son. Will you tell me what this is about?
Sure. Well, we're all kind of living in our own bubbles these days. My 18-year-old son came to me, Larry, and said, Dad, why don't you do a podcast? And I have to tell you, the number of times my 18-year-old son comes to me and says, Dad, you want to do anything is pretty limited. So I said yes before I even knew what it was. He's stuck here with us. And so I thought it would be a fun project. As it turns out, we had an opportunity to build what I call it 50% Winston Churchill, 50% Fred Rogers. Give people the information they need in a way that's helpful, that's truthful, that's unifying, but also is helpful and gentle. It's intended to be listened to. You should be able to listen to it with your entire family. And we have had some really great and interesting guests. We've had Mark Cuban. We had Governor Phil Murphy, Amy Klobuchar. We just had the most recent Surgeon General of the United States. We're going to have Anthony Scaramucci on coming up. Chelsea Clinton, Tina Fey. So people who, and we're really talking to them about how are they getting through the virus? How do you make people laugh? How do you inform people? How do you scientifically think about what we're going through, and how do you help people with the mental health issues, the financial issues, and otherwise?
Are you enjoying it?
You know, I am. It's really interesting because I've the privilege of, you know, being able to pick up the phone and call people like senators and governors and people in the White House and to focus on these issues. And what I'm doing now is saying, "Hey, do you mind if I record this from my podcast?" And so people can actually hear Governor Murphy and I in New Jersey talk about how to get resources on the ground. And so I want people to feel like they're getting an inside look at people working on this problem, how they're working on it, what the issues are, what we know and what we don't know. And so far, everybody's been incredibly gracious. I have, if I had in my pinky the knowledge you have about how to interview people, I'm sure the podcast would be a lot better. But it's I'm just starting figuring that out.
Andy, thank you so much. Continue good luck, and let's hope that when we talk again soon, this is over.
Thank you. All the best to you, Larry, and your family. Stay healthy.